So if you've watched any kind of television, you've seen commercials talk about toothpaste for tartar, toothpaste for gingivitis, and of course, cavities. But we hear this phrase gum disease that seems to be a catch-all for things that can actually be quite complex. Your earliest sign that you're experiencing a form of gum disease is if you brush and you spit in the sink and you see some red due to bleeding. Now, that can be due to you brushing too hard, but you will know that because it'll hurt. But if you're brushing and there's no pain and you spit and there's blood, you have a baseline level of inflammation that is weakening your gums, your gingival tissue, and allowing it to free bleed due to that. That is what we call gingivitis or early gum disease. Now that can and does progress if it is not taken care of, whether through heightened hygiene regimens at home or cleaning here at the dental clinic. And if it is allowed to progress long enough, your gum disease will progress into affecting the bone underneath the gum in that level of inflammation, and you will develop what's called periodontitis. In my neck of the woods, it is referred to as pyorrhea of the gums by old timers, but it is when things have gotten really bad. The fuzzy stuff you feel on your teeth when you wake up in the morning has been allowed to set for too long and calcifies through the natural minerals that come out in our saliva that the body typically uses to repair, but the bacteria will take and utilize to basically create themselves their own little fortress, similar to what a barnacle would do to a boat. It is a calcified little castle that sets and holds to the tooth next to the gum line, and you cannot brush it off with, it's reinforced. So as it sits there, the gums will then come in and lay across that, and microscopically, it's a bed of nails. So as it lays there, it gets inflamed, it swells, it bleeds, and then it tries to get away. And as it pulls away, well, we've got all this new space, and the bacteria will take that and just follow. Well, and as the gums go and it follows, and we get to the level of the bone, that's when we start having the problems of the periodontitis disease.